Good afternoon. Thank you for joining us today. We hadn't planned to have a media briefing today, but in an effort at full transparency, we wanted to present to you today and be able to take questions. A number of weeks ago, we outlined the triggers that we measure daily in terms of guiding our coronavirus response. Out of all the triggers, 3 of those have been highlighted as individual or singular triggers that if we crossed that line or threshold, we would take some type of action because it was an indicator of an increased spread in the community. Today we have, for the first time, crossed one of the triggers, and today we are reporting and sharing that we have had 8 community outbreaks in the preceding 7 days. Throughout the duration of our response to coronavirus, we've always said that one individual day does not make a trend, but one individual day can hit a trigger. And so today we are crossing that threshold and metric. Generally, we are seeing community outbreaks at restaurants, private businesses, private residences, houses of worship, businesses, office buildings, social clubs, and in the case of these, we are seeing them in a widespread area throughout San Diego County. Now, it is important to put in context that none of these outbreaks appear to be linked to one another. They are geographically dispersed, and again, the number is you hit the trigger when you have more than 7 new community outbreaks in a 7-day period. As you'll see in the chart in just a minute, 3 of our outbreaks will fall off of our list tomorrow. And so it is entirely possible, dependent upon what happens today, that we could be under the trigger tomorrow. And so again, we want to see a trend. We want to continue to monitor it. We want to continue to see what's happening. But in light of the fact that we did cross one of the triggers, we are taking the following 3 actions. First off, we are going to pause on any implementation of future guidance from the state of California on reopening of additional entities until such time as we have greater clarity in terms of the stability of the metrics and in particular the community outbreaks triggers. Those entities that are planning to open tomorrow will be open and able to open tomorrow, but any additional guidance that comes down from the state of California for future entities to open will be paused until we have a greater sense of period of time and observation to understand what's going on. Second, we will be looking to step up enforcement, targeted enforcement on specific entities that are not complying with the public health orders. We did this on one occasion a number of weeks ago when Dr. Wooten issued a public health order related to a specific restaurant, and we will be looking and monitoring to see if there are other isolated instances where there's clear and egregious violations of the public health order that we believe compromise the public safety and public health moving forward, and we will be stepping up our activities of possible enforcement activities in a very targeted way. And then third is not a new action, but we want to take this moment of hitting a trigger to convey to the public the seriousness that our region faces and the challenges that we face surrounding coronavirus. Yesterday, I shared with you the number of counties across California that are seeing significant increases in spikes. Most of those counties were primarily in hospitalizations and ICUs, and that tells us that the danger out there remains. We also know that hospitalizations and ICU utilization is a lagging indicator. What is a more forward indicator are things like community outbreaks and number of cases. And so we take this with an understanding that it could be an indication that we could be heading in a direction that is not positive. And so we continue to implore the public to please adhere to the public health orders. Please do not have gatherings at your house. We have a number of outbreaks of private residents of individuals who decided to have house parties. Please utilize face coverings. Please utilize physical distancing among non-household members. Please do all of the things we need to do, because at the end of the day, even the most robust enforcement of the public health orders will not be effective. The only thing that will be effective is if each and every San Diegan decides that they're going to do their part to help us get out of this. From the beginning of our reopening process, we said our ability to reopen and do it smoothly, consistently, and stay reopened would be predicated on our ability to adhere to the orders in the public, to take the same energy and spirit that had us a model for the entire nation at the beginning of this and apply that to our adapted behaviors as we move forward. And so we continue to ask for the public's help and guidance. These are measures that have been put in place to allow us to reopen, to allow us to get our economy going, and to allow us to save lives and preserve the integrity of our healthcare system. And so we continue to ask for your help and guidance in all of that. Second is I want to address the state action the governor took today around face covering. This is of less significance to San Diego County because we are one of 9 counties in California that already had in place a mandatory face covering requirement. I think in recognition of the growing body of scientific evidence that supports the utilization of face coverings as a way to slow the spread of coronavirus and slow the transmission, the governor today has implemented a statewide face covering requirement. That does not substantively change what we are doing here in San Diego, as we already had that in place, but we wanted to share with you we will be updating our public health order to have our face covering language mirror that of the state of California, just in an effort to provide greater clarity and greater insight in terms of what we're doing, and I'll walk you through a few slides of what that is. Before that, I want to share with you the outbreak trigger dates for the 8 cases that we are seeing today. Here you'll see on 6/11 we had 3 cases, one at a business, one at a restaurant, the second at a business. 6/16 we had 2, one at a business, one at a restaurant, one at a private residence. I'm sorry, that was 3. And then 6/17 we had 2, one at a campground and one at a social club. So as you can see, we will know tomorrow what actually transpired today, but 3 of these will fall off of the 7-day tracker. And so depending upon our numbers for today, we may be back under the trigger tomorrow. We just don't know, and we won't know until tomorrow, but we wanted to put in context what we're talking about. Next, let's go into the state guidance for facial coverings. Californians must now wear face coverings anytime they are inside or in line for any indoor public space. So this is essentially when you leave your house and you are going out in public and you are inside or in line for indoor public space. This would be everything from a grocery store to a movie theater, getting your hair cut, any of these types of things. Californians must wear face coverings when seeking medical care, essentially anywhere you go to get medical care. You must utilize your face covering when you're using public transportation, a taxi, private car service, or ride sharing. Californians must wear face coverings as it relates to workplaces, which you can see right here. Anytime you are at work, you must wear it when you're interacting in person with the public. Anytime you are in a workspace that is regularly visited by the public. You have to wear it when food is prepared or packaged for distribution. Anytime you're in a workplace, when you are in areas working or traveling through common areas such as hallways, stairwells, elevators, or parking facilities. And you have to wear it at a workplace in an enclosed area when you are unable to physically distance 6 feet or more from those folks who are around you. And so we will be putting this into our public health order to bring San Diego consistent with the state of California. And the last one here is Californians must wear face coverings when they're driving public transportation vehicles, when passengers are present, and when outdoors in public spaces where physical distancing of 6 feet is not feasible. We'll come off the chart for a second here. I want to walk you quickly through a few of the exemptions that are in the statewide order. Persons of age 2 years or under are exempted. Persons with a medical condition, mental health condition, or disability that prevents a face covering. Persons who are hearing impaired or we're communicating with a person who is hearing impaired, and the ability to be able to see the mouth is essential for communication. Persons who wearing a face covering would create a risk to the person related to their work as defined by state, local, or federal regulations or workplace safety guidelines. Persons who are obtaining services involving the nose or face for which temporary removal of the face covering is necessary to perform the service. That'd be like going to the dentist. It'd be kind of hard to get your dental procedure if you had a face covering on. There's a guidance around restaurants. We're asking for a little bit of clarification on that, as it seems a little inconsistent with the reopening guidance on restaurants. So we are adhering to the reopening guidance surrounding restaurants until we get further clarification from the state, which is that when you go to a restaurant, you shall wear a face covering until you are seated, and we will continue to adhere to that until we get further clarification from the state. And then there's a specific exemption for persons who are engaged in outdoor work or recreation, such as swimming, walking, hiking, bicycling, or running, when done alone or with household members, and when you are able to maintain a distance of 6 feet from everyone else. And so again, today we wanted to share with you the trigger that we crossed. We wanted to put it in the context of the totality of the situation we face, share with you the actions that we're taking today, and then update you on the governor's guidance. Next, we're going to hear from Dr. Wilma Wooten, who will go into more depth on the outbreaks, share with you a little bit more information about those, and then we will take your questions. Thank you.
So thank you, Supervisor Fletcher. Today we are reporting one of the 13 triggers as abnormal, and the one trigger of concern is related to community outbreaks, as Supervisor Fletcher has stated, and you will see it's number 2 on this slide that is framed in the red box. The trigger is if 7 or more community outbreaks are reported in the past 7 days. And as you can see here, our number is 8 for the past 7 days. And we'll have an additional slide that lays all of that out in just a minute. So for the past 7 days, and that is from June 11th through June 17th, the county has identified 8 community outbreaks. These include outbreaks in 3 businesses, 2 restaurants, 1 private residence, 1 campground, and a social club. Also, there was 1 additional outbreak that was identified or included in our report this morning, but was later deemed to not fit the definition. Our staff determined that conducting their quality assurance process. So that location where we thought there was an outbreak has been determined not to be an outbreak. So again, we have now 8 community outbreaks, again above the trigger or target for this trigger at 7 in the past 7 days. So the next slide shows community outbreaks in another way. Actually, if you can go for it. Yes, thank you. On the left, the number of weekly outbreaks is shown from March 25th through June 9th. On the right side of the slide, it shows the number of daily outbreaks since June 10th. So you will see basically that over the past 8 days, from June 10th to June 17th, we have had outbreaks on 3 specific days, 3 on June 11th, 3 on June 16th, and 2 on June 17th. And as Supervisor Fletcher stated, tomorrow, then the last 7 days will be from June 12th through June 18th. And if we do not have any further outbreaks identified today as of 11:59 tonight, then tomorrow we should have 5 outbreaks. Now, as the nation, the state and the county of San Diego is opening back up, we must all do our part to prevent the spread of COVID-19. The best practice strategies essential for businesses to follow would include practicing good hand hygiene and sanitation, cleaning surfaces that are commonly touched, maintaining physical distance when you come in contact with individuals outside of your household, using a facial covering, and conducting screenings, which include temperature checks to prevent the spread of disease. That is for businesses. This slide identifies what individuals should do. And these are very important and overlap with strategies, best practice strategies for businesses. But these include, again, practicing good hand hygiene and sanitation. Individuals are recommended to keep 6 feet apart from others, not in your household. Wear a face covering, avoid crowded places, and stay at home if you are sick. Another important action that individuals take is to not have friends, coworkers, or other individuals not from your household gathering at your home for dinner parties, cocktail parties, barbecues, or other events. So we are not there yet, and quite frankly won't be there until sometime next year when we have herd immunity so that people will not become infected, hopefully. So lastly, as Supervisor Fletcher has shared, the state issued guidance today for the use of face coverings, and this is very timely with the fact that we have increased outbreaks. The guidance states that Californians must wear face coverings when they are in high-risk situations. This includes going into indoor public spaces, any type of healthcare settings, public transportation, interacting with the public, and while outdoors in public spaces, and if it is not feasible to maintain a physical distance of 6 feet from persons who are not members of the same household or residence. There are also exceptions for certain individuals related to children and those with certain medical conditions, and Supervisor Fletcher went over those earlier, and all of this information can be found on the CDPH's website. Growing evidence from other respiratory illnesses support the use of face coverings. Recent studies published over the past 3 months have shown that wearing a face covering has protected people from COVID-19. The World Health Organization, the Centers for Disease Control and Prevention, and now the State Health Department recommend the use of face coverings. And in fact, the state is now requiring face coverings for the locations that I provided just a few minutes ago. A team of scientists from the University of California, San Diego, Caltech, and the Texas A&M worked together recently to analyze the transmission pathways of COVID-19. Their study confirms that face coverings determine the pandemic's trends and significantly reduces the number of COVID-19 infections. As well, the U.S. Surgeon General, Jerome Adams, shared that, and I quote, "Some feel face coverings infringe on their freedom of choice. But if more people wear them, we'll have more freedom to go out. Face coverings lead to less asymptomatic viral spread, which leads to more places open and sooner." So when we breathe, talk, yell, sing, cough, or sneeze, we release respiratory droplets. These droplets contain viral particles. We now know that individuals without symptoms can be infectious. By wearing a face covering, you can protect others around you, and when others wear face coverings, they protect you and others around them. With everyone wearing face coverings as appropriately defined, the entire community is protected. By implementing public health measures, which include wearing face coverings, we can all emerge from this pandemic and be stronger together. Remember to wear a mask. It's an easy task. You can save a life if you do so. Thank you for doing your part and being public health heroes. And now I'd like to welcome Supervisor Fletcher back to the podium. Thank you.
Thank you, Dr. Wooten. We'll now go to our call-in questions.
Artie Ojeda with NBC7. Please state your question.
Good afternoon, everybody. I'm going to just, first of all, give this due diligence, even though I know the answer. You've had an outbreak at a campground, in a social club just yesterday, a business, a private home the day before. These are fresh. These are new. Can you tell us where they're happening? And my second question would be, places like the Gas Lamp are closing off streets to open up more restaurants, get more crowds down there. Same thing happening in Little Italy. How concerned are you about, more people gathering like that? And what kind of political pressure are you feeling to avoid restricting businesses that have just reopened?
Well, Artie, I'll tell you, I'm always concerned. I've been concerned since February when we started this, and I think that our concern is what drives our vigilance, and the vigilance is what drives us to be here in front of you today to share with you that we crossed a threshold and a metric, to share with you the actions we're taking, but also to put it in the perspective of everything that we're seeing. In terms of the geographic locations, they are dispersed throughout San Diego County, and as Dr. Wooten has mentioned before, when we think that there is a danger to the public, then we will share a location. If there's something specific that the public needs to know, then we will, of course, do that. But to arbitrarily do that would undermine the confidence of people to cooperate with our contact tracing investigations, and would ultimately be more negative to our ability to slow the spread of coronavirus than it would be positive. And I understand the curiosity, and I understand the desire to know, but ultimately we have to make decisions we think in totality balance out, giving us the best ability to confront the public health challenges that we face. In terms of what we're seeing, the pictures that we saw out of the Gas Lamp were very concerning. And we worked with those associations, we worked with those places. I think that the efforts to close the streets there are more a desire to spread people out in an outdoor setting. I will tell you there is significantly less concern about individuals outdoors than they are indoors. And so if you can close streets and allow more outdoor dining and allow more spacing outdoors, we think that that is a positive step. But we are really dependent upon business owners to enforce the protocols in their businesses. And that relates not only to what happens indoor in terms of the spacing and the sanitation, but that also relates to those individuals who are waiting outside or might be crowding. And so we continue to work with the business community, and we think the overwhelming majority of them are doing the right thing and want to do the right thing. But as we mentioned earlier, we will be looking to increase enforcement on folks who are egregious violators of what is happening. And so that is the best we can do with where we are right now in terms of moving forward. If at some point we see a huge linkage between cases, or we see one particular type of entity being more vulnerable, it might cause us to reassess the actions we're taking. But what we think we're doing right now is proportional to what we're seeing. Next question.
Matt Hoffman with KPBS, please state your question.
Hi. Among these community outbreaks you all are seeing, what common themes have you found? As in, like, were these all the businesses not following like the mask mandates or employee guest screening protocols, not following sanitation measures?
Well, I don't think that there has been. I'll let Dr. Wooten address this. I don't know that there has been a consistent theme we've seen other than places where people congregate. And, if we had seen, Matt, very specific things, then it would give us specific actions to take. The reality is, as you reopen, more people gather. And as more people gather, there's a greater risk of transmission, which is why we continue to stress the vital importance of all the actions we've taken. Nothing we do is going to stop the spread of coronavirus, but we need to slow the spread of coronavirus. We need to contain the spread of coronavirus. And so all the measures we put in place are designed to do that. And if we had seen particular instances of things, that would give us more targeted actions we could take. But I'll let Dr. Wooten address any trends she may have seen in the community outbreaks.
Okay, cool. Yeah, I was just asking because you guys said you were going to do like targeted enforcement. So just you guys might have seen must have seen some trends.
I'm sorry, I didn't hear the last point that you...
It was just coming off of the supervisor said that you guys were going to be doing some targeted enforcement. So I imagine you're seeing some trends in terms of people not following the rules or certain businesses or...
Yeah, what is obviously being seen, particularly in private residences or the social club, people are gathering. And people are gathering and not using facial coverings. The way that COVID-19 is spread is primarily through person-to-person contact, and it's spread through droplet transmission. So we've, there are really some very unique graphics out there about that, and that's how it spread. So when people come together and are within 6 feet of each other without facial coverings, it's bound to happen. There was actually a piece on the news this morning about girlfriends that just got together at a happy hour, and 13 out of the 15 that gathered together, they did not have a mask on, became infected. So that's the commonality, particularly when people are gathering. At work sites, it could be very similar. So that's why we are, I think that this facial covering guidance from the state is coming at a very important time, because as we open up and people think that they can go back to the pre-COVID-19 existence, we cannot. This virus is in the community. Some people can spread it without any symptoms, and the strategies that we've shared with you today are the strategies that are needed to help reduce the spread of this virus.
Gotcha. And then just in terms of the triggers for community outbreaks, I know the threshold for concern was 4 in a week when we first started reopening. Now it's 7. The trigger for ICU beds used to be scaled to 30% capacity. Now it's 20%. As we move to reopen more businesses, do you foresee continuing increasing trigger thresholds, and how do you weigh or calculate those decisions?
Very early on, when we talked about the attestation and the triggers, we stated that we would be modifying the triggers based on available information to us. And the trigger going from 4 to 7, that was actually done in the same week, shortly after the attestation form was submitted. And what was the other one that you talked about?
It was the ICU beds from 30
Yeah,
to 20.
that trigger came from the state. So that is actually ICU beds, I believe, is 20%, and then ventilators is less than 25%. So those are metrics that came from the state.
Gotcha. So as you guys learn more about the virus, you guys can change the triggers, basically.
You know, I'm pretty happy with our triggers right now. We potentially could add additional triggers, but you're absolutely right. And as we've stated previously, as we obtain more information, the triggers may be tweaked. Thank you for the question.
Thank you.
Matt, just one point to follow up too is when we talked about targeted enforcement, I think what we're referencing there is if we see individual entities that are specifically very egregiously not adhering to the orders, we could step in as we did with the restaurant some number of months ago. And so we certainly, Dr. Wooten has that tool that can be used, and as we see those types of entities, we can do that. The second thing I want to point out is a number of these outbreaks are in entities that are not supposed to be open. We are not, we've taken considerable heed about not lifting the gatherings restrictions. And people say, why can't we get a bunch of people together at our house? And a bunch of people are clearly getting together at houses, and we're getting outbreaks that are tied to gatherings that shouldn't be happening. And the reality is there's simply no way to enforce that, even in terms of what we are. And that's where we're asking the public. The orders that have been put in place are designed to keep us open and keep us moving, and we need the public's help. So an outbreak at a social club, the social club shouldn't have been meeting, because that's not consistent with the public health orders. And so we're asking for the public's continued cooperation and help as we make our way through this. Next question.
Morgan Cook with the San Diego Union Tribune. Please state your question.
Hello. Have any of the outbreaks, recent outbreaks, had a lot more cases attached to them than others, like any super spreader events, anything like that?
I'll let Dr. Wooten speak to the specifics of the outbreaks.
So the definition for a community setting outbreak is 3 or more cases that are confirmed with COVID-19 testing, and they should not be related cases. So 3 or more cases. So the highest number of cases so far with the cases that we're talking about for the elevated measure, 4 or 5 cases. So, but we've certainly had outbreaks in other locations that have been much higher. But in these, that's been about the average.
Okay. And so health officers in other counties and states have been threatened over, the order to wear masks. Have you received any threats like that related to masks?
Yeah, we're not going to go in any details about that. Our focus is to do the right thing and help to protect the public's health. Thank you.
Okay, and the questions.
Morgan, I would just add one point to your first question, which is, as we contact trace, we continue to get better insight in terms of what's happened. So an outbreak that just happened yesterday with 4 individuals, as we go through the contact tracing process, it is possible that additional individuals are ascribed or attached to that same outbreak, so that the numbers could change over time.
Okay, do we have any indication of the total number of cases or deaths caught up in these 8 outbreaks that were reported in the 7-day window?
There's been no deaths associated with them, and we'll have to get back to you on the cumulative number of cases.
Okay.
Thank you. Next question.
Lori Weisberg with the San Diego Union Tribune. Please state your question.
Hi, I have 2 questions. One is probably because you've already answered it, but it's more a comment. I understand that your continued reluctance to divulge the places where these outbreaks have taken place. Some have been at restaurants. One earlier you saw on the list was a resort hotel. As a journalist, I'm just pressing you to reconsider that. I think the public deserves to know where these places are in the same way that you disclose the ratings and letter grades for restaurants when you inspect them. I think that should be made public. You've given your answer, but I'm asking you to reconsider that because I think it is the public's right to know that. Second, Supervisor Fletcher mentioned that one of the actions you're taking is going to be pausing any future state guidance for future reopenings. I do know that the theme parks are anxiously awaiting the governor's statement on when they can reopen. SeaWorld and Legoland have said they want to reopen July 1st. Could that pause that you're talking about affect those, the desire of those to open by July 1st if the governor was, in fact, thinking about allowing them to reopen in July?
Yeah, so I'll address both of those, Lori, and I understand where you're coming from, but I think what's important to note is that any time there's a concern that there's a danger to the public, that information will be shared. And so as a part of the follow-up is working with the business and understanding what happened and what's going on and what steps they're taking. And if there's ever a concern that there is a danger to the public from a specific location, Dr. Wooten will share that information. If we automatically shared every single location, we would systematically undermine our ability to get cooperation, which would fundamentally hurt our ability to contact trace and slow the spread of coronavirus. And so it's out of a desire to protect public health in totality that policy is in place, and that is a consistent policy across everywhere. So again, if there's a danger to the public, that information will be shared appropriately, but we also have to preserve the integrity of our ability to have cooperation and engagement in terms of what we're doing. On the second one, it really is a hypothetical that we would be irresponsible to comment on. We know today that we crossed a trigger, we crossed a line. We know that today we've said for any future guidance that comes out, we'll be taking a pause on implementation of those. But we really have to look at what's happening on a day-by-day basis and understand the trajectory, the trends, and where we are on each point. And given that guidance has not been released by the state, it'd be a little premature to speculate on any status surrounding it. Next question?
Can
Yeah.
I just
You have a third one?
follow up on
Okay. Go ahead.
Can I follow up on the restaurant question?
Sure.
I just as you were talking, I noticed that the blog post, there was a blog post in Eater San Diego saying that there's a restaurant in Little Italy where they're going to have to close because a member of their staff has tested positive for COVID-19. Is that something you can confirm? The reporting that it's
I can confirm there's a blog post that says that. But
so you, as a county, can't confirm whether that is indeed true, that a restaurant employee is tested positive?
To date, that we've only had outbreaks in 2 restaurants, and they are associated with staff. So we are not currently investigating the situation that you are sharing.
Okay, thank you.
Also, I just want to cite the fact that when, particularly if outbreaks in businesses are with staff or employees, and we can identify who all of the employees impacted, if we can identify those, there is no need to issue a press release or a news story. I can tell you if there is for instance, with a restaurant, and if we don't know who all has been at that restaurant, that's why we are strongly encouraging restaurants to have reservations so that they know who's been in their restaurant at any given time. Otherwise, we would have to issue a press release if the case warranted. So just wanted to let you know that that is our practice. Thank you.
All right, next call.
Mark Ziegler with the San Diego Union Tribune. Please state your question.
Yes, I had a question about youth sports in light of your announcement today about triggers. There seems to be a lot of confusion about what is allowed and what is not allowed. Most youth sports clubs across county have returned under the day camp guidance in stable groups of 12. Is contact or must that group of 12 remain socially distanced for the duration of their practices?
We'll let Dr. Wooten address that.
I think thank you for the question. Regarding youth camps, I think we were very clear on the guidance for that. It is not for a competitive practice, a maximum of 12 children, and they must maintain social distancing, wear facial coverings, everything that we constantly talk about. They can conduct practice, but again, not as they would if they were, there's no competition or playing with others. So that was the purpose for providing that guidance so that students could be out and be exercising. So again, there is guidance that we understand will be coming from the state regarding youth camps, but right now we do not have that. So what we are doing is under the umbrella of activities for youth. In terms of youth camps, not sports, not youth sports. The youth sports guidance should be coming out from the state sometime in the next several weeks.
And as a quick follow-up to that, if I'm understanding you correctly, so there are some soccer clubs I understand are holding within those groups of 12 3-on-3 scrimmages or 6-on-6 scrimmages, other ones that are not. You're saying that those 3-on-3 scrimmages are not allowed. And in terms of that guidance that is coming out later, how will that be affected by your news today with the triggers?
Yeah, Mark, they should be physically distanced when feasible. So again, we're talking about practice. We're talking about kids gathering together. We're asking them to be responsible. Groups of 12 follow the guidance as best they can while we await further guidance about actual organized competitive type activities. So we're doing the best we can to open up some opportunities for our kids to get out there and get some exercise and get some recreation. We're asking them in groups of 12, physically distanced when feasible. Please be as responsible as they can, and then just hang in there while we wait for additional guidance.
Okay, and those additional guidances, will they be affected by your news about triggers today?
Well, if they came out today, they would be, but we don't know what tomorrow will bring. Great. Next question.
Sasha Fu with KUSI, please state your question.
Well, you've answered most of my questions. I had a whole bunch of them, but I do
Let's
want
go to
some
the text question.
clarification on. No, I have one more question.
Okay.
I do want to ask about the enforcement side of the face covering order that was issued by the State Department of Public Health. At this time, I mean, it seems unrealistic that you would have law enforcement able to ticket or cite people for not wearing a face covering. So you're counting largely on voluntary compliance by members of the public. Is that correct?
Well, we're counting on folks to comply with the public health order, which is the law. Public health orders have the effect and impact of the law, and so we are expecting cooperation. But you know, Sasha, it shouldn't require enforcement. The simple wearing of a face covering is an individual action we all take that allows us to continue to reopen and allows us to get large sections of our life back in place. And so if we don't have good adherence to that and we don't do those types of things, then we're likely to see increases in numbers. And so our goal from the beginning of reopening has been a smooth and steady and consistent recovery. But in order for that to become a reality, we really need the public's help and cooperation. And so we really hope to see widespread utilization of face coverings because, as Dr. Wooten pointed out, there is a growing, every day, a growing body of scientific evidence that suggests that this may be one of the most effective things we can do. Thank you.
That sounds good, but I know there are people who are pushing back against it. They don't believe in the efficacy of the face coverings, and they feel that it doesn't help at all. So what do we do about those individuals? What if that's a fairly large portion of our community?
Well, look, the reality is we're a very divided country, and we have a number of individuals who share misinformation. We unfortunately sometimes have a number of outlets who share misinformation and promulgate things that are just not factually basis. And that makes our job harder. That makes the reality of reopening and staying open harder. And so the best we can do is go out and share with folks the intention behind this is out of a desire to reopen and protect life. It's a temporary thing. It's a sacrifice. It's a little bit of an inconvenience, but it's a very mild one compared to the other side. And so we will do the very best that we can to share fact and science and best practices, and we will count on those entities who have large platforms to hopefully do the same. We'll go to our text questions.
All right.
Thank
great.
you.
Great. This first one is from Mimi with Channel 10 News. If we continue to see community outbreaks and need to pause reopening efforts or even scale back, which businesses would have to close first?
Well, Mimi, that's a hypothetical on top of a hypothetical. So we probably shouldn't start speculating on if something might happen, then what might we do? The reality is with the outbreaks we've seen now, they come from a variety of different places, both geographically. They also come from a variety of different entities, whether it's a social club or a church or a restaurant or an office setting or a private residence. And so we will always take actions that we think are proportional to the situation and also actions that are driven by that. And so if we see particular trends, then that would give us an area where we could potentially go in and take some action. But at this point right now, it really doesn't point to one specific thing. It's just larger number of folks gathering in larger number of places. And so that's why our actions are to take a momentary pause on any new guidance that may come out, look for increased enforcements of entities that are egregiously violating public health orders, and then continue to work with the public to get as widespread compliance as we can, and then continue to monitor the data, because at some point it might point to something specific we would take, and at that point we would share with you what that action would be and what the underlying rationale was for it.
And this one is in relation to the law enforcement. She's just wondering if now that the state has made this announcement today, does it actually require officers to enforce that facial covering rule?
Well, it is a public health order that has the effect of law, and law enforcement certainly could enforce it if they chose to, but you would have to ask individual law enforcement jurisdictions as far as their posture or inclination to enforce that.
And this next question is from Jacqueline with Fox. If nail salons and spas, all those that are set to reopen this Friday, are they still okay to reopen? And what entities are left that have no reopen date? Is it concert venues, festivals? What about the zoos, SeaWorld, schools?
Yeah, the entities that were cleared to open tomorrow are allowed to reopen. We hope that they do it with great caution and great adherence to the public health orders in light of the situation that we're facing here in San Diego with our one trigger and in light of what we're seeing across California and across the country. And so we continue to advise folks to please follow the health guidance. We think it gives you the best opportunity to avoid significant spread in terms of where you are. There are a number of entities that we're awaiting guidance. You heard one earlier about youth sports leagues. There's certainly more around theme parks, concerts, venues, higher education. There's a number of those we're still waiting for guidance from the state of California on. And so we will continue to wait for that guidance, and we'll continue to monitor our situation and our triggers, and then we'll be able to assess as we move forward.
So as far as we are concerned, this Friday's reopenings are on
Yes,
schedule?
that's right.
Okay. And this is from Carlo Chiquetta, Channel 8. Can you tell us how many days it has been between outbreak events and the outbreaks being confirmed?
That is a good question. I'm going to turn that over to Dr. Wooten.
It could range anywhere from the outbreak being confirmed within the same day, or it could take anywhere up to 48, sometimes even 73 days or more. So it ranges because it depends on being able to contact the entities that are involved and gather information, and it may be more than one entity that's involved. So it requires the time that it takes to conduct the case investigation and gather all of the information to determine if a particular incident satisfies the definition for a community outbreak.
Thank you, Dr. Moon.
Carlos, I would just add to that, we have a significantly larger workforce doing contact tracing now than we had at the early stages, which hopefully gives us better insight into being able to track and trace and link cases back to specific things. And so we think that gives us better insight. And just to reference what we said earlier, an outbreak that occurred yesterday or today with a specific number, that number could increase over time as we delve deeper into the contact tracing efforts around reaching out to all of those individuals who are there. So I believe we have one final question.
We do, and it's from Mike McKinnon with KUSI News. Dr. Wooten said no gatherings with neighbors until next year. Can you explain this in a little more detail?
Sure.
I'm not quite sure how much more detail. You know, it is what it is. We are now in the throes of a pandemic. Until we have herd immunity, which means that there is anywhere from 70, 60, or 70, 80, 90% of the population that has immunity, whether natural immunity or by vaccinations, and we do not currently have vaccines. So that's what I meant in terms of next year. And with the individuals that are infected, and then with individuals that are vaccinated once an effective vaccine is produced and made available to the public, we will not have herd immunity. So again, that's why we are stressing the need for individuals to wear face coverings and to conduct all of the other best practices that we talk about every day. But facial coverings have been proven to prevent the spread. It's not the end all to everything, but it helps to prevent the spread. So we must utilize all of the tools in our arsenal to help reduce the spread of this infection in our community. Thank you.
Thank you. That concludes our briefing for today. We do not have one scheduled for tomorrow, and barring some unexpected news, we won't have one tomorrow or through the weekend. We will be reporting out daily the traditional case totals, testing totals, hospitalization rates, and other information, and we expect to be back with you Monday afternoon at 2:30. Thank you.